Great news for women with PCOS who are trying to get pregnant. Research shows losing 5 to 10% of body weight can be enough to start naturally ovulating again. But this can be a huge challenge to lose weight. Give me 4 minutes of your time and I will reveal the 5 main self-care strategies that I give my clients to help them lose weight safely and efficiently. And for those of you who don't know me, I'm Dr. Gina Terranoni, and I've helped over 2,000 women and couples to become pregnant and have healthy babies over the last 23 plus years. All of the videos that I personally create have at least one actionable fertility tip that women can easily start the same day. Drop the word ovulate below, and I'm happy to send you my PCOS Pathway to Ovulation guide that my clients use successfully to start ovulating in an average of 2 to 3 months. Research confirms that anovulation, or the absence of ovulation, is the most common cause of infertility in women with polycystic ovarian syndrome, or PCOS. Approximately 75% of women with PCOS who experience infertility do so because of anovulation, making PCOS the leading cause of anovulatory infertility. Let me show you how my clients who are trying to get pregnant with PCOS are losing 5 to 10% body weight with specific lifestyle changes. By following my PCOS clients' eating strategy, my clients lose 1 to 2 pounds weekly just by following this very specific regimen. One of the first steps to get started is to add in anti-inflammatory foods and low glycemic Mediterranean foods to their diets. Adding in foods like leafy greens such as spinach, kale, and other dark leafy vegetables, cruciferous vegetables, including broccoli, cauliflower, and Brussels sprouts, and then berries like strawberries, blueberries, raspberries, and lean proteins like fish, chicken. All of these are good choices, and healthy fats are avocado, nuts, and seeds. And focus on organic as much as you can. Number 2 is to avoid foods like sugars that you find in sodas, fruits high in sugar, fried foods, processed foods, lunch meats that's processed, fast foods, refined carbs like white breads and pastas, and treats like pastries. And some women with PCOS are also sensitive to dairy and gluten. And number 3 is try to eat no more than 80 grams a day of carbs and make sure to get at least 60 to 90 grams per day of protein, depending on their medical histories. Some women with PCOS benefit from intermittent fasting or time-restricted eating, depending on their weight and if they have diabetes. This must be tracked with a doctor or a healthcare practitioner. Some women also do well with keto-type eating. Again, this depends on their medical history. And number 5, avoid hormone disruptors like we find in bath and makeup products, cleaning agents, and kitchen items like cooking pans. They should not be Teflon. I have my patients use toxin-free, like iron skillets, food storage containers. Glass is healthy and not full of toxins. Don't use plastic, but some of them are BPA-free, so that's okay. And avoid using chemicals that we use in gardening and so many other chemicals that come into our lives. Many women who aren't ovulating think their only option is to induce medical ovulation with Western drugs and treatments, which usually comes with IVF treatment. Sometimes this works, but medically inducing ovulation comes with risks and side effects that may include multiple pregnancies, ovarian hyperstimulation syndrome, mood swings, emotional impacts, bloating, breast tenderness, abdominal pain, nausea, and headaches. And some studies suggest a potential link between the use of fertility drugs and an increased risk of ovarian cancer, though this area needs ongoing research. And in rare cases, there may also be risk of blood clots, liver dysfunction, and kidney problems. My clients focus on regulating hormones in order to lose 5% of their weight with diet and lifestyle changes. My clients with PCOS who set a realistic goal of losing 1 to 2 pounds per week not only start to ovulate again, but they also experience hormone regulation, regular menstrual cycles, and experience reduced excessive hair growth and acne. And research shows changing specific eating habits can help women with PCOS lose 5 to 10% of their weight, and they begin to ovulate again. My methods that I use with my clients are all based on research and clinical results with patients and clients. Drop the word ovulate below, and I'm happy to send you my PCOS Pathway to Ovulation guide. that my clients use successfully to start ovulating in an average of 2 to 3 months.